Good evening, good afternoon, and good morning. This is the 1478 days of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. ROJA VARANASI. We welcome all to this session. Let us begin the session with 1 minute silent prayer.
Good evening, Dr. Danish. Namaste.
Please wait, madam.
Okay. Good evening, Dr. Danish. Am I audible now?
Doctor, please wait, please wait. Let me introduce it was the time for silent prayer, and so just
Okay.
over. Thank you all for joining the session. Today, our guest is Dr. Roja Varanasi, MD, and she is a PhD, a scholar also, and working as the research officer and scientific grade 3. She is Central Council of Homeopathic Research in New Delhi, and she has done her post-graduation at Abhin Chandra Homeopathic Medical College and Hospital, Bhubaneswar, Odisha. She is a passionate researcher and interested in clinical research. Her interest area is non-communicable diseases, morbidity, pediatric disorders, etc. She is also called co-nodal officer of the integrated NPC DCS Irish Homeopathy Project CCRH in collaboration with MOHF Family Welfare Government of India. She has significantly contributed to the development of standard treatment guidelines in homeopathy published by the Council. Today, the Council has published 4 volumes of standard treatment guidelines covering 66 clinical conditions. She is also the coordinator to the development of STSG for Irish Systems and Irish Vertical Director General of Health Services, Government of India. The Council has also developed, she also has contributed to system dosage healing and specific scientific framework for homeopathy. She has been working since so many years in this field. And Dr. Roja also presented more than 20 scientific papers in international and national forum of CMC. She has won many awards, Young Scientist Award in Clinical Research in 2018, from the Central Council of Research in Homeopathy, Ministry of Irish, and she is currently pursuing her PhD in Public Health from Amity University, Noida, from Uttar Pradesh. As you know, being a research person, she is talking about integrative care with the homeopathy tonight. The guest of the day, Dr. Roja Varanasi. Welcome, doctor. Yes, you are muted. Please unmute yourself.
Okay, 1 second. Yeah. Am I audible now?
Yes, yes.
Thank you so much for your humble introduction about myself. And shall I share my screen now?
Yes, yes. It is the second presentation from Dr. Varanasi Roja.
Okay. So my screen visible to all of you?
In English session, and session is taken. Yes, yes, it's switchable.
So thank you once again for giving me the opportunity to speak on integrative care and how homeopathy can contribute to it. I have been listening so many topics at this platform with clinical experiences, and this is very overwhelming to learn from this platform. But in the current scenario where we are being showcased as homeopathy being popular, not only in India, but also in the Western world. But how we can contribute to this? Only for rhinitis, only for skin disorders, only for small complaints, ailments, or do we need to integrate? Do we need to uh, ponder on some more conditions which is need of the hour, like non-communicable disease, which is cropping up in India due to its burden and aging population. So here I want to focus upon the strength of homeopathy in integrative care with a view and citing some of the research evidences. Because wherever we go, whatever platform we use, wherever we face the challenges in front of our allopathic counterparts, everyone asks us the evidence. And without evidence, without knowledge, we may not stand with our counterparts. So it is need of the hour that we should learn. We should increase our knowledge regarding the strengths of homeopathy in integrative care and how homeopathy, because of its safe, gentle healing, can contribute in this area. So this is the National Health Policy, which came published by Government of India in the year 2017. The policy clearly focuses on research. It emphasizes developing protocol for mainstreaming Ayush as an integrated medical care. This has a huge potential for effective prevention therapy that is safe and cost effective. Further, the policy commits itself to support programs for prevention of blindness, deafness, oral health, endemic diseases like fluorosis, sickle cell disease, anemia, thalassemia. So these all things have been extracted from the National Health Policy document, and which is under, and in that document there is a heading non-communicable diseases, and this is the excerpts of that heading. So because government is emphasizing on mainstreaming of Ayush and also on integrated care, so do we have any evidence? This is the question of today's day. So the Niti Aayog, that is think tank of India, planning commission earlier named, now it is Niti Aayog. They are also emphasizing integration of Ayush registered practitioners, educational institutions, Ayush hospitals, and all these, they also are calling for integrative care. Because of this, today, at different AIM setup, we have Ayush wings opened up, where Ayush doctors are posted for giving healthcare services through Ayush system. So the integrative health policy aims to bring best practices of modern medicine and Ayush systems together to provide comprehensive healthcare to an individual and the community. Because we all know, day in and day out, we go through the newspapers, we see many things happening. Recently, in the 11th of September, in the Hindu column, there is an opinion paper on Montulucast, which is a type of medicine, allopathic medicine, which is given along with antihistamines. But it is seen that long continued intake of Montulucast leads to psychiatric disorders. And even at the end, the patients, they do suicide. So this is a recent paper which have been published in the Hindu column as an opinion column. So keeping in view all these things happening, do we need not think of, and do we need not think of how we can integrate? Because we may claim many things, but until unless we have sufficient evidence, our voice will not be kept or we will not be acceptable in this scientific forum or scientific fraternity. So that's why the integration is necessary and evidence is necessary. So what is integrative medicine? It is a simple, no, there is a definition which is very simple. Integrative medicine is not simply the combination of conventional medicine with complementary and alternative medicine, but the consortium of academic health center for integrative medicine defines it as the practice of medicine that reaffirms the importance of the relationship between the practitioner and patient, focuses on the whole person, is informed by evidence, and makes use of all appropriate therapeutic approaches, healthcare professionals, and disciplines to achieve optimal health and healing. It is health and healing. So, in this juncture, we can think of homeopathy. But what happens again? Because there is a need for integrative health. Why it is a need? Because focusing on a person in the complexity. So we need holistic approach. Strengthening the position of patients, emphasizing responsibility for their own health. emphasis on prevention, health literacy, and healthy lifestyle, emphasis on self-healing, stimulating innate self-healing abilities of the organism, which we all know as a homeopath, how we instigate by giving homeopathic medicines in small doses so that the patient heals themselves through the energetic vital force within us. Building a doctor-patient relationship, emphasis on well thought out combination of appropriate healing practices and teamwork to find optimal treatment. What are the benefits of integrative care? So it improves the outcomes, it improves patient satisfaction, improves treatment cost or effectiveness, reduces over-treatment because, for example, we see in hypertension or in diabetes, there are multidisciplinary approaches are available like diet, physical activity. Along with that, the patient takes some antihypertensives or oral hypoglycemic agents or insulin. But if we think of adding homeopathy, if we have success stories, we can reduce the cost, reduce number of medications, reduce over-treatment. We can minimize the waste, redundancy, and eliminate insufficiency. Therefore, these are the various benefits which we have when we have integrative care. But what are the challenges? There are two challenges, like we have less awareness because we have less knowledge of the information which is available. We have less availability. We think of availability, affordability, accessibility, because people are not so much aware about the evidences available. Doctors are not aware about the available evidences so that they can tune up with the patient, they can motivate them, they can inform them, and both the doctor and patient can have an informed decision about the various interventions available and how we can give them best healthcare to the patients. So, a short survey was done where we have seen there are few evidences available in homeopathy as an add-on treatment and in different clinical conditions like mental health, diabetes, geriatric care, drug abuse, musculoskeletal disorders, infectious diseases, respiratory complaints, cancer, gynecological complaints. So these are the different areas where we have seen that homeopathy can be beneficial as a add-on treatment to different disease conditions. Now let us focus on one because the time is limited. I may not be able to go through details of all the literature which is available, but of course, I can share with you some of the summaries of these studies, which will help you to understand the evidences which are available and how we can also contribute to the growing evidence of homeopathy in the integrative care management. So first of all, I would like to show this one, that is adjunctive homeopathic treatment in patients with severe sepsis. This is a randomized double-blind trial which was conducted in Vienna. The patients who were hospitalized, admitted to ICU, were given homeopathy, with sepsis were admitted, were given homeopathy, and this study showed that after giving homeopathy on day 180, the survival of the patients who were given homeopathy was better in comparison to the patients who were not given homeopathy. So the authors concluded that homeopathy is useful additional therapeutic measure with a long-term benefits for severely septic patients admitted to the intensive care unit. Definitely, here it is a research, it is a randomized double-blind placebo-controlled trial. It may not be possible for a clinician to do such a big study because research always demands teamwork. So, however, whenever a doctor faces these type of cases and he has the opportunity to treat a case, definitely they should record properly and then they should write it down and share so that other homeopaths can learn through their evidences. They can publish and they can learn through their evidences. Next is additional benefits of homeopathy in the treatment of chronic periodontitis, a randomized clinical trial. So this is a single blind randomized controlled trial where 40 patients with chronic periodontitis and 20 with chronic periodontitis healthy group participated, and one was submitted only to CPT, that is the patient were given the CP patients were divided in two groups. One was submitted only to uh, no homeopathy group, but they were given only scaling and healthy healing of the uh, oral cavity, and the other group was given homeopathy, and they were assessed for 90 days. The findings concluded that after giving homeopathy, the improvement was better, and the adjunctive, when homeopathy was given to as a adjunctive to CPT, not only the periodontitis improved, but also that is the oral health, but also there was improvement in the patients who were suffering from diabetes too. So this is a preliminary study which authors published in a very good journal. Followed by this, these authors only, they conducted another study, that is homeopathy and periodontal treatment in type 2 diabetic patients, a 1-year randomized controlled trial. So in this trial also, the patients of chronic periodontitis received one group, they were given homeopathy, but here the homeopathy was not individualized, but they included a package of care like berberis, mercurius solubilis, belladonna, hippocsulf, and pyrogenina, while the control group received only equivalent look like placebo. The clinical and laboratory examination were evaluated at baseline, 1 year, 6 months, and 12 months. And it was shown that both the groups showed significant improvement throughout the study for most of the parameters. But the test group, that is where homeopathy was given, had a significant gain of clinical attachment levels at 1 and 12 months compared to the control group. Along with this, the mean glucose and glycosylated hemoglobin significantly decreased in both groups after 6 and 12 months. However, there was significantly further reduction of these parameters in the test group. So we have added benefit with homeopathy. In conclusion, the authors concluded that homeopathy is a supplement to non-surgical periodontal therapy, that is cleaning, scaling, and planning, may further improve health condition, including glycemic control in type 2 diabetes patients with CP, that is chronic periodontitis. These authors recently published a paper on 2 setups. They did a study on 2 setups, and here also they have shown that homeopathy as an adjunctive to periodontal treatment improves local and systemic clinics and provide better health condition to patients with or without type 2 diabetes. So this shows that with gentle homeopathy and minimal medicines, many things can be, antibiotics can be avoided, long-term benefits can be given to the patient in chronic disease, especially chronic periodontitis. This is a study on cancer, that is non-small cell lung cancer. So this is a big trial which was done, and this study was published in mainstream journal. So here 50 patients with stage 4 non-small cell lung cancer were included in the study. 98 received either individual homeopathy 51 or placebo 47 in a double-blind fashion. Conventional medicine, because here this is a very good study, here all the medicines which were given to homeopathic group were individualized. There is no particular specific medicine here, and all were given individualized homeopathy. The 50 patient number is, I think it is a typographical error. It is 150 patients approximately, and these patients were divided into 98 received individual homeopathic remedies and equal to 51 or placebo 47. So after giving homeopathic medicine, Dr. Frass, he has shown that conventional medicine and homeopathy work well together. Quality of life improves with additional homeopathy in these type of patients, and survival also improves with additive homeopathy in patients with non-small cell lung cancer. And the list of medicines which is used is very huge. This paper is freely available. Everyone can download and go through the results. And it is a very interesting paper. And this is a study which was done in Delhi by Delhi Homeopathic Anusandhan Parishad, NCT Delhi. And here the patients, that is the multi-drug resistant patients, multi-drug resistant pulmonary tuberculosis patients were randomized to either add-on homeopathy or standard care. And in this, 120 diagnosed patients were included, and they were randomized to receive standard regimen plus individual homeopathic medicine or standard regimen plus identical placebo. So it was observed in this study that overall significant improvement was seen in chest X-ray, and there was also improvement seen in weight gain, increase in hemoglobin when homeopathy was added, and with a better response by the patients. The cure rate was 11.4% more in the homeopathy group as compared to placebo. So the intention behind showing these studies is that we have lot many evidences, but we need more evidences to have a good randomized control trial or a systematic review or a meta-analysis, which will help us to place before the policy makers the strengths of homeopathy. Because whenever we talk of homeopathy, they never think of acute conditions, they never think of very chronic conditions, long-term conditions. So there is always a dilemma, juxtaposition, what to do. So at this juncture, we need to have lot of evidence. We need to generate lot of evidence through case reports, through case series, because just now, my previous speaker was showing very good cases, success stories of them. But we listen to through these platforms. But it is high time we should publish these outcomes, which the success stories which they have systematically, so that more evidence can be generated. Now I come to acute condition, acute encephalitis syndrome. This was an epidemic few years back, and we did a study, 3 studies seriously in BRD Medical College, Uttar Pradesh, Gorakhpur. So here first we did a exploratory observational comparative study, then we did a randomized placebo control trial, and third one is a retrospective study. Around 1,000, more than 1,000 patients were enrolled in these studies, and it was seen that after giving add-on homeopathy, the mortality was reduced, the morbidity was reduced, and the patient, the children, the target population was children here, they could work well, and the death rate was almost 50% less compared to the group which did not receive any homeopathy. Now coming to mental conditions. Homeopathy is add-on treatment for schizophrenia. This is a case series which was published by a group of researchers from National Homeopathy Research Institute in Mental Health, Kottayam under CCRH. They have reported 5 patients who reported in the NHRIMH OPD with symptoms of schizophrenia, and they were treated with Indian homeopathic medicine as-on therapy to conventional medicines, because we all know schizophrenia is a condition which requires lot of care and cautious management. So after giving add-on homeopathy, these patients were assessed through a specific PAN-SS scale and Glasgow antipsychotic side effect scale. And they have seen that all 5 patients showed improvement as evident from the assessment scales. And this case report is published in our IGRH, that is Indian Journal for Research in Homeopathy. It is free, it is downloadable, open access journal. So they can go through this case series, see how the prescription was made, because in this platform, it may not be possible to read out each and every study in details. I repeat each and every study in details, but I want to showcase here the different areas where homeopathy is touched and research evidence has been generated. This is again effect of adjuvant homeopathy with usual care in management of thrombocytopenia due to dengue. You all must be aware, those who are from north side, but in 2015 there was an epidemic in Delhi, especially dengue, and lot of patients were admitted to all the hospitals. So CCRH also at this point of time, CCRH, the research scientists from CCRH conducted this study at the Hedgewar Hospital, New Delhi. And here in this study, patients who were admitted to the hospital were with having dengue and also had thrombocytopenia. 138 patients in this study, 138 patients received homeopathic medicine along with usual care, routine care, that is antipyretics, or whatever the patients, the doctors that prescribed to the patients, they were taken by the patients. Along with that, homeopathy was added, and 145 patients received usual care alone. The thrombocytopenia was assessed with as the main outcome measure. And after giving homeopathic medicine, it was seen that there was statistically significant greater rise in platelet count on day 1 of the follow-up in the homeopathy group compared to the usual care. And 80% of the prescriptions, if you see this paper, 81.2% of the patients received Crotalus horridus. And Crotalus horridus could easily reduce the platelet leak and also help in increasing the platelet count. So platelets was prescribed when the fever has subsided, but still there was no improvement in platelet count. Crotalus was prescribed 30 in potency twice daily till, and the platelets were repeatedly investigation was done, and it was seen that at day 1 there was significant increase in the platelet count in the homeopathy group compared to the usual care group. This is a study of not of in India, but in the Western world. A group of researchers continuously published series of papers in different clinical conditions, because in Western world we know there is a chance that the general physicians can practice homeopathy. In Indian setup, the scenario is different, where in Western world, the scenario is little bit different. Everyone in the Western world, there should be a medical doctor, and thereafter they have a chance, as of their choice, they can practice complementary and alternative medicine. So this study was done by a group of general physicians, who among them practiced homeopathy and few among them practiced only conventional medicine. So from now onwards, there will be series of slides which will show this type of studies, which shows the difference between the prescription of the general physicians or the physicians who practice homeopathy. The first study here is management of upper respiratory tract infection by different medical practices, including homeopathy, and consumption of antibiotics in primary care. We all know government is much motivating and much worried about antimicrobial resistance. It is day in and day out propagating how to reduce the usage of antibiotics, so that when we need, antibiotics can be easily prescribed or safely prescribed, so that unnecessary use of antibiotics can be avoided. So this study was done, and we all know that mostly in common cold, upper respiratory tract infections, antibiotics are routinely prescribed or routinely prescribed. So national-wide population-based study of a reference sample of 825 GPs, 825 general physicians and their patients in France were the part of the study. Study outcomes include medication consumption, upper respiratory tract symptoms resolution, and potentially associated infections, that is sinusitis or otitis media or externa, as reported by patients. So 518 adults and children with upper respiratory tract infection were included in this study, as opposed to general physician practicing conventional medicine. Patients in the general physician homeopathy group showed significantly lower consumption of antibiotics. Definitely, this is a good thing for us. Homeopathy can contribute vitally and importantly in the reduction of antimicrobial resistance. And also there was reduction in consumption of antipyretics, anti-inflammatory drugs with similar evolution in related symptoms. Patients who choose to consult GPs certified in homeopathy use less antibiotics, antipyretics, anti-inflammatory drugs for the upper respiratory tract infection than those seen by GPs prescribing conventional medications. This is another study because we all know the common diseases are upper respiratory tract infection acute conditions and the chronic or musculoskeletal disorders. So this is again an evidence of impact of physician preferences for homeopathic or conventional medicines on patients with musculoskeletal disorders. Results from EPI3 MSD cohort. So here 1,153 MSD patients, that is musculoskeletal disorder patients, were included in the 3 physician practicing preference groups. And here it was seen that non-steroidal anti-inflammatory drug use over 12 months was almost half in the homeopathy group as compared to the conventional medicine group. MSD patients seen by homeopathy physicians showed a similar clinical progression when less exposed to NSAID in comparison to patients seen in CM practice, with fewer NSAID-related adverse events and loss of therapeutic opportunities. Because we all know every allopathic medicine has its own side effects. No doubt, the relief but continued intake of these medications is always side effects. So, definitely adding homeopathy reduces the use of NSAIDs, although the progression of disease was similar, but reduction was high in the homeopathy added group. Utilization of psychotropic drugs, because we all know post-COVID era has lot of mental diseases. The mental well-being is challenged, and especially if we see sleeping disorders is one of the important aspect. Is lot of patients visiting you all may be having completely sleeping disorders. So in this area also, this EPI3 group have done some studies. So they have seen that the utilization of psychotropic drugs by patients consulting for sleeping disorders in homeopathic and conventional primary care settings resulted in some very good findings. 346 patients consulting for sleeping disorders were included. Patients in the GP homeopathy group experienced more often severe sleeping disorders than patients in the GP CM group. The conclusion is that patients with sleeping disorders who choose to consult GP certified in homeopathy consumed less psychotropic drugs and had a similar evolution of their condition to patients treated with conventional medical management. These results may translate in a net advantage with reduction of adverse events related to psychotropic drugs. This is again another mental condition, anxiety and depressive disorders in older adults, in patients more than equal to 65 years of age. Here it is seen the patients who consulted GP homeopathy were more likely to have clinical improvement after 12 months of treatment, and on the other hand, they also reported less psychotropic drug use and benzodiazepine use compared to the GP patients, the patients who were visiting the GP conventional medicine, visiting the GP conventional medicine. So definitely these all studies where there is reduction in psychotropic drugs, where there is reduction of antibiotics, reduction in NSAIDs, definitely homeopathy has a potential and vital role as an integrative care system, integrative care medicine. This is another study which was done in Germany as an integrative medicine program for geriatric patients. It is a small study with small sample, but the outcome here is that this integrative medicine program was feasible and the patients using homeopathy as a package of care showed more improvement. No doubt it was statistically not significant, but definitely it is a lead which asks us to carry out more trials on this area, and CCR is now venturing on this aspect to collect more evidences systematically through research. Now, another interesting thing is homeopathic ear drops as adjunct in reducing antibiotic uses in children with acute otitis media. So this study was done on 210 children, and follow-up of antibiotic data was collected on 206 children. During the 12 to 15 days follow-up period, fewer parents of children randomized to homeopathic ear drop group filled the antibiotic prescription compared to those of children receiving standard care. Matlab only in the children who were using antibiotics, ear drops, homeopathic ear drops, that is 26.9% of the parents required antibiotics for their kids, whereas 41.2% of the children, 40.2% children in the standard care group required antibiotics. So definitely, external ear drops are also effective in reducing the use of antibiotics in children. This is another study because COVID is important. It gave a wide area, wide footage for homeopathy, not only in the country but throughout the world. So this study was done at a hospital setup, an integrative care setup at Chirayu, Bhopal. In this study, when homeopathy was given as adjunct standard care, there was discharge of the patients 2 days early, and there was early symptom relief compared to the patients who were on standard care alone. Next is a study which was done again by CCRH at two setups, one in Delhi, AIIMS, Jhajjar, and the other one at Mumbai, St. John's Hospital. Both the studies they have shown after giving add-on homeopathy, there was reduction in mortality, morbidity, reduced requirement of oxygen, and hospitalization. So these are the two studies which showcases the beneficial role of homeopathy in COVID-19. This is another study which was done outside India, and they have shown that adjunctive homeopathy treatment of hospitalized COVID-19 patients shows early speedy discharge. That is 92.3% were speedily discharged without relevant sequelae or complications. And there was time-dependent improvement of relevant clinical symptoms in 12 surviving patients. This is another study because we all know there is hemoglobinopathies like sickle cell disease, like thalassemia. So these are also getting improved when homeopathy is added. In this study, when homeopathy was given along with standard care, the preliminary results indicated that there was a significant decrease in the fetal hemoglobin and in the treated subjects. Although the change in other parameters were not so significant, but there was significant decrease in size of spleen in most patients with splenomegaly and improvement in general health conditions along with increased gap between transfusions in most patients receiving the combined homeopathic treatment. So this is another study on hemophilia which was done by a group of researchers from Mumbai, Nasik, from Maharashtra, Nasik. They have shown that number of bleeding episodes, hematosis is reduced when homeopathy is added. The pain also improved significantly when homeopathy is added. And number of joint bleeds per month was reduced significantly under influence of homeopathic therapy. And this is a study done by CCRH. Here they have shown the annual bleeding rate was less after 1 year of treatment with homeopathy. So these are the various evidences which we can see. This is another one on premenstrual disorders. This was done in Netherlands and Switzerland. But because of low sample, this study could not be done multicentric. But it has shown that the well-being, the severity of problems reduced when homeopathy is added in the premenstrual disorders, and also mental problems due to uh, premenstrual disorders. So these two studies also show that after 4 months of treatment, there is mean change, a reduction in the DRSP, that is symptoms related to psychiatric issues which may accompany with the premenstrual disorders. Now this is another setup which we can see, that is integration of homeopathy in public health system. In this, around the records of almost 6,000 patients were examined from 2003 to 2016, and they have shown that 88.8% of general medicine patients with follow-up completely, and also 68.1% of patients had a major improvement or resolution in the symptoms which they reported to the physician. And in women, an improvement was obtained in 74.1% cases and a major improvement in 61.2% cases. In cancer patients with homeopathic and integrative treatment, a significant improvement was observed for all the symptoms during anti-cancer therapy, particularly for hot flashes, nausea, depression, asthenia, and anxiety. So we have seen so many aspects, so many areas where we have strength of homeopathy. However, we need more evidences to satisfy to the policymakers, uh, stakeholders who will be the torch bearers to promote homeopathy, and also to mainstream homeopathy in an integrative setup. So as told by Dr. Dhanesh in the introduction about myself, this is the glimpse of how we did the NPCDCS integrated program in 4 districts of India. Almost 6 lakh patients attended the OPD, and around 300 lakh patients were screened. And we did yoga classes, we conducted yoga classes, we involved yoga experts. In this way, we tried to bring awareness about homeopathy in the 4 districts across the country. And along with that, our sister councils like Ayurveda and Unani, they also took some districts and promoted homeopathy in the NPCDCS program. So what is homeopathy? Should we keep an open mind? Of course, homeopathy and integrative medicine, we should keep an open mind. And we should also venture ourselves in different palliative areas where palliative care is need of the hour, and steady diseases where symptomatic management is the only chance, no surgical intervention can be done. We can follow, assess, advise, agree, assist, and arrange. Along with different medications, we have vast armamentarium of homeopathic medicines which can be used for different symptomatic management for different conditions, especially cancer and end-stage diseases. So integrative medicine is not the merging of alternative medicine with conventional biomedicine. It represents a higher order system of care that emphasizes wellness and healing of the entire person. Its primary goal, drawing on different medical approaches in the context of a supportive and effective physician-patient relationship. And this, for this, we can explore many areas like supportive care in oncology, geriatrics, pediatrics, musculoskeletal disorders, psychiatric disorders, respiratory disease, So the road is vast ahead. We need to explore, we need to venture, we need to document, and we need to publish. So we need to overcome the barriers. We understand the factors, the administrative reorganization, the evaluation methods, good teamwork, different changing clinical culture, supportive regulation, clinical leadership. There are various ventures we should put on. The enablers, the barriers we should identify in implementing integrated care so that homeopathy can be easily mainstreamed. We need to have education, we need to practice, we need to research. These core things will lead, the Venn diagram shows the core things which need to be done so that we can show the possibility, overcome challenges of integrative medicine, implementing integrative medicine and with homeopathy. So, as said by our former stalwarts, prove all and hold fast to the good is and remain the first commandment of science. Medicine is an experience, a science of experience. Practices a continuous experiment, and the experiment is not concluded. Freedom of thinking, freedom of science, that is the highest palladium, and it must so remain if we are in progress. No type of despotism, no soul ruling, no suppression of thought. Only proving through experience, discussion, and counter discussion, continuous free study and time can and will surely in the end separate truth from falsity and the useful from the useless. So thank you so much for your patient listening. I hope I could tell you something, share with you some information which is helpful and
Yes,
enhance our
ye-
knowledge.
yes, Dr. Varanasi Roja. It's really a very good session, and you show how the beauty of homeopathy in all different areas and how the scientific research work was done by you people. But unfortunately, all those things are not coming in the public, and we need to uh, take all note of take all these things to the media, so that the media need to be come forward and propagate these things among public, because even today we see what we see is that people used to say that it is a pseudoscience and there is no relevance. But just some 3 days back, when I sent some medicines to some people in Australia, suddenly the person look at the Google and search and, oh, doctor, it is banned in Australia. And I told him that it is not so. My daughter took a lot of medicine there, is working there, and she is taking a lot of medicine along whenever she travels to Australia. Some of our doctors are working there with homeopathy. So it is not banned in that way, but it is written in Google such that it is being banned. So what we need is to that the media is a big role to play here, and what you people have to do is make some fun for propagating these things as an advertisement or something like that, or even like news item, a paid news item. We can send it to the big newspapers and the so-called visual medias also. Otherwise, what things are done being ignored by the scientific community, so-called scientific community, because you have shown how homeopathy works in conditions of ear with our eardrops along with antibiotic. It works in a better way like that. So anyway, these are the information you share. What all information you shared here are really brilliant, and I invite Dr. Manoj to add something more on that.
Thank you, Dr. Fanesh, and this is really an encouraging session. And what happened is that we have enough publications, hundreds of research papers are there, but still we lament that we don't have results. Then another thing, we repeatedly uttering the word evidence. What was evidence there when they were giving this Monteleu cast? Your appreciate, yes, they have evidence, they have evidence. There was evidence that was effective. Now what happened to that evidence? Did you question them? Did anybody question them? Nobody questioned them. So that is the actual situation or the reality behind all these evidences. So I think we don't need to treat through that way. We have our own methodology. And what is more important is that what is the approach the Central Council of Research Homeopathy takes. And nobody can question it because it is the highest body, technical experts. No other experts from other systems can interfere with that. It is very evident that when the CCRS published a communique in 2020 March regarding the effectiveness arsenic album, it was accepted. Nobody questioned. But so just like that papers, just the recent the monkeypox and almost all complaints, sudden immediate response is needed from these bodies. Otherwise, what happened? What happened to Patanjali? Even though he is giving a lot of medicines, he don't have the support of the Indian system of medicine. So that is the role of this Central Council of Research in Homeopathy, and you are doing a commendable job. What is needed is that be more confident in facing the public. That's the most important. Thank you.
Yes, exactly. That's what Dr. Manoj also told. The research people at National Council of Homeopathy as well as Central Research Council of Homeopathy is doing excellent job, but still there all these things are there in the paper only. But we have to bring notice of the media, all medias. We need, because the other people are spending lot of money for their research work, and they are publishing all those things by paying a big amount. But we people are not doing such things. So we need to at least 10% of the money to be reserved for that. That much thing is needed. Then only people from the other scientific side will note all these things. Of course, you people are doing research with the help of the medical fraternity from other side also. This is what I would like to add. Anyway.
Then again, Dr. Ganesh,
Yes.
you mentioned about this research is a teamwork. I think research, not only research, but the education, the practice, these are also a teamwork. Without the team, we cannot make an institution to educate our students. So research work, all thing, everything, including this IFPH is also a teamwork. Dr. Ganesh is the backbone of that. Conducting the program for the last 1,500 days, uninterrupted. It's a world record, maybe. So just like that, always, that is why Ken always remembering us. Things will grow brighter as minds are brought together and men think harmoniously. The more we keep together, the better. The more we think on us, the better. That's it. Togetherness is
So
needed.
I would just like to add here.
Yeah.
It is a platform, a very good platform. I on and off visit this platform. I hear the speakers saying, but I would like to request, it means my humble request, because clinicians, we in India have 3 lakh homeopathic physicians throughout India. And we have very good clinicians. But if each clinician at least contributes one good success story, either in the form of publication, or we have a platform, homeopathic clinical case repository. It is an online platform of CCRH. The clinicians, they can contribute success stories to this platform so that we can have a evidence hub, because dropping one water will make a tumble, right,
Yes.
sir? So each and every homeopath, if they drop one case report to that tumble, will have in passing days, like you have 1478 number and number of IFPH workshop today or conference seminar today. Similar way, sir, because your people are taking lead, doing the things systematically without any tireless effort. You are doing conducting this. So the number is now more than 1000. In similar way, when we talk of 3 lakh homeopathic doctors in India, we should contribute from our side at least one case report success story, because you are seeing n number of patients. It is not that every case can be recorded, but some cases can be recorded successfully by yourself, so that you are also contributing to the building of evidence generation for homeopathy. Because we know, and it is a challenge for us, because modern medicine is so strong. The scientific parameters, the scientific evidence, the day in, day out, the number of publications, the number of research, the funds is so strong in their side. And we, as a homeopaths, the research, the funding, the manpower, the skills are still, both are not comparable. But we can give our best efforts, what we are doing, so that with one drop of water every day added, we can make a glass of water.
Yes,
So
yes,
this is what I would like to urge.
yes, definitely we will do that. We are what we are doing also is the same to promote homeopathy among public health. This is the primary aim, as well as connecting between doctors around the world. And as you might have heard about the Kerala homeopathic department, they are doing excellent work in
Yes.
uploading every case in that comes on the clinic every day. That means that we more than 1 lakh, nearly 2 lakh cases are already uploaded in the website of Kerala government homeopathic medical department. That is something. That means these all those things are there in the as there as evidence. So this is the beauty of the present generation of homeopaths in and around the world, particularly from doctors from Kerala is doing hard work in, because we are the people who are facing a lot of challenges from IMA people, and that's why each and everyone is working hard to bring these things to public. Thank you, Doctor. I invite
Thank you
Dr.
very much.
To say vote of thanks to the session.
Thank you, Dr. Ganesh ji, and congratulations, Dr. Roja. Very good presentation, research work, integrative medicine in homeopathic program. Really very good. Other system of medicine which gives the many diseases. Homeopathic medicine, systematic way of treatment and symptom vanish and relieve the patient. So very, very thanks, Dr. Roja. Thank you. Behalf of IFPH, again presentation. Thank you.
Thank you, Dr. Ramparesh sir, and those who attended the session also. Thank you.